My name's Dr. Elizabeth Waring. I'm an obstetrician and gynecologist, and I practice here at Island Health. So my specialty is obstetrics and gynecology, and to be honest, it was the one specialty that I said I would never do when I went to medical school. But I think like a lot of us who come into this field, once you start, it's an amazing field of medicine. The level of connection that you have with your patient is really unparalleled, and that's really why I love what I do. Gynecology in particular, it's a very private form of medicine, and it takes a huge bond of trust between a patient and a provider in order to provide adequate and comprehensive care. So obstetrics, I think everyone's pretty much familiar with. It's a standard schedule of routine prenatal care. And so we are able to care for women not only through preconception counseling, through the pregnancy, delivery of the child, and then support of the family and the mom in the postpartum phase. Gynecology can really include preventative wellness exams to extremely complex surgeries. I think a lot of people aren't necessarily aware that obstetricians and gynecologists are surgeons. We complete a 4-year surgical residency, and as such, any kind of pelvic surgery for a female is something that we can do. I came to Island Health for a couple of different reasons. One was that I had come out to this area back in 2016 when I was in training and just fell in love and knew that I always wanted to come back. When I came out here to interview, I was very impressed, and I still am, with the fact that this is a small community hospital that was really built by and for the community, and that's really what drew me in. This isn't a large place where you can get lost as a patient. As a provider, I don't feel like a cog in a machine. I feel like an individual where my practice is respected and my relationship with my patients is respected, and I can provide that comprehensive wraparound full care that I don't think I would get in a larger community. So when you come in for a visit with me, the number one thing is that we're gonna talk before any kind of exam. The bond that a patient has with their gynecologist, it's based on trust, and that's really profound, and it's something that I'm very much aware of. And so my goal with any patient encounter is to really get to know you as an individual before we go into the medical side of things. So I always want to meet my patients before I examine them. And then also knowing that you're always able to contact us after an appointment. I think oftentimes it can feel really rushed given how short our appointment times are, but we're available outside of that time as needed. We have an excellent support staff. You can message us through the portal, and we're here for you.